We are here with the CEO of UPTH Premium Hospital in UPTH. I know most of you are wondering, what is a premium hospital doing in a public hospital? I also wondered the same, and that's why we're here to answer questions. We're going to take a tour around the facility. We'll show that to you. But let's have a conversation first. Good afternoon.
Good afternoon.
Let's allow you to introduce yourself.
Okay, my name is Dr. Tianye Sokari. I'm the CEO of Patrica Health Services. It's a firm that partnered with the University of Port Harcourt Teaching Hospital to set up the UPTH Premium. So being the CEO of UPTH Premium also means that I am responsible for ensuring that patient gets the best care, right? And also ensuring that the facility meets the objectives of both the university, the teaching hospital, and also the private sector. Mm-hmm. Now, the unique thing about the teaching hospital, the UPTH Premium, is that it serves as a public-private partnership, which is something that even the president has been pushing forward, where you use the scale and the scope of the public sector with the efficiency and finances of the private sector to come together to create value for the end users. In this case, the end users are the patients, also third-party B2B partners. Mm-hmm. Now, healthcare being an absolute utility needs to be prioritized, but we can't leave it for either part. The private sector can do so much, the public sector can do so much. So it's more of a synergy. Mm-hmm. And the idea behind that is to create something that patient can get the best of both worlds. And that bettered the UPTH Premium idea.
Okay, why is it situated in UPTH? I know it's a partnership between the both private and public, but why situated in UPTH? And I ask that because patients that come to UPTH would feel kind of slighted because they are operating in a public hospital and they are also aware that there's a premium hospital in that public hospital. Couldn't you have situated it somewhere else?
Okay, you see, this is UPTH, right? This is UPTH. It's not a private hospital. It's UPTH. Okay. So where else would UPTH be if not on the premises of UPTH? Now, you have to look at it from the perspective of operatorship. Mm-hmm. We are operating it on behalf of UPTH. Okay. All right, so this is also UPTH. This is not a different entity. We are just operating it from the private sector, all right? Okay. Now, patients will not feel slighted because the idea is to provide the level of care. See, everybody knows that tertiary institutions give the best care. Everybody knows that. You want to get, if it can't be done in a tertiary institution like UPTH, it can't be done anywhere in Nigeria. Okay. So we're actually providing an alternative for the patients. Now, note that the same doctors in UPTH are the same doctors here. The difference is some patients find something like AC a big deal.
Okay, let me paint a scenario. In a case, we have the same clients, those in need of medical services. We have a family coming to Premium, the same family, a different family going to UPTH. And we know that the professionals at UPTH are also the professionals that operate here. Now, I'm just asking you this, so you answer not from any bias points. Where do you think they would get, which of these families would get the best service? Not the environment, not the ambience, but the service of a doctor's attendance, a professional doctor attendance.
I can assure you of one thing, right? When it comes to clinical care, there are few places in Nigeria as good as UPTH. Few places, right? And this is because of the retinue of professors, consultants they have there, not just for the doctors, the nurses, the biomedical, everything, the whole cadre, right? Now, what we are trying to do, it's not just about the patient one-on-one, right? We're also looking at it much more than that. You're using an iPhone, right? There are other cheaper phones, but you chose to go with an iPhone. So it's important that we understand that there's no difference when it comes to clinical service. It's the same thing. Mm-hmm. All we are just trying to do is to offer some level of private sector engagement and some efficiency some flexibility that the private sector gives. That's the only difference. But when it comes to the core value, which is clinical service, it's the same thing. You're still getting the same nephrologists, the same, in some cases, professors, consultants, or urologists, whatever the specialty or the cadre or the level, it's the same thing.
The hybrid you have with UPTH and the private sector, why don't we just see it in UPTH? Why it has to be?
Okay, all right. The reason why it's UPTH has some social value. The government has some social value. What that means is that whatever you pay in UPTH has been subsidized by the government. It's subsidized healthcare, and so it is not sustainable when it comes to for a private sector organization, right? Because the government makes a loss every month, and there's no investor, no private company that's willing to make losses every month. But you see, it's not about the service. It's not just about the extra service. The key thing is accessibility. That's the problem with healthcare. You see, even though we have UPTH, like I've just said, has the best of care, a lot of patients do not come there. They feel it's for those on the lower socioeconomic value chain, or it's for those that are really, really sick. But where you have the best minds is where you should go for healthcare. And that's what UPTH stands for. So we are trying to say, look, if you feel that you are a Dangote, but you want to access care, you can still come to a place that you do not have to be subsidized by the government, and you can have those extra perks. So that's the whole idea. Now, when it comes to clinical service, like I said, it's the same, but for this private sector, see, what we are doing is an experiment. We are hoping that with this, more of the private sector individuals will come and support government in all they are doing across the tertiary institutions.
All right, takes me to my next question. Is this like the first of its kind? Although I know this is bearing UPTH Premium, do you have other private hybrid hospitals in other states?
Yes, when you talk about concessions, the government has been open to that for quite a while. Now, this has cut across infrastructure. It has cut across, in fact, roads, tolling of roads. That has been
I'm
done
specific about hospitals.
Healthcare.
Yeah.
Yes, this is not the first.
Okay.
Right. Now, there are different levels of this.
Managed by the same private institution or a different one?
Yes, managed by a private institution, not the
same
tertiary.
one handling UPTH Premium?
No.
Okay.
Right. What we have done is that we've taken a model that already exists and we've tweaked it for UPTH Premium.
Okay.
Right. So it's not a copy and paste actually. It's something that we have improved on existing model. But basically the objective is the same. Create access with between other private institutions like most of the HMOs, the companies. It's easier for private to plug in than private public to plug in.
Yeah.
So we have been able to create that kind of integration, while at the same time ensuring that across the socioeconomic ladder from the lowest to the highest, you can have access to the great minds you have in UPTH.
All right. The key question I think most persons would want to find out is the price difference, this place and UPTH.
You see, it's difficult to compare to UPTH because there's a word I use. I said UPTH is government's baby. For every 1 naira you pay, the government is paying about 9 naira for you.
Okay.
So you can't compare really. Rather, what we should be comparing is, okay, how do you compare this with the same level private hospital out there?
Let's use that analogy you painted earlier. If you're paying a naira, government is paying 9 naira.
Yes.
So say the fee for a particular service is 10 naira. Yeah. At UPTH, they pay 1 naira.
Yes.
Here, what would they be paying? Is it the entire 10 naira?
Now, it's complicated because there are some services that efficiency reduces the cost, right? So we could actually have some services that you pay 2 naira and you receive the same care without being government baby. And there are some tests you have to do, some services maybe 5 naira without being government baby. Now you see what the private sector brings to the table is efficiency. Efficiency.
Yeah, but what the people look out for is costs.
Yes, that's what I'm saying. Efficiency reduces the price. So what we try to do is to reduce wastages. What happens is that when there's high wastage, it's translated to the patients.
Okay.
So what does the private sector do? What do? We simply create that level of efficiency such that something that could have been done with 10 naira is being done with 5 naira. And who benefits from that? The patients. Because rather than paying 10 naira, they're paying 5 naira. Right? So, you see, when it comes to healthcare, it's important that we understand some things. Right? First, healthcare professionals need to be paid properly. Because you see, if we drop the price to such a state where we have to pay them peanuts, we will not have any specialists left. Let me give you an example, right? I barely have up to 30-40% of people I graduated still in the country. So you see that 60-70% of them have left. So until we are able to compare healthcare, put them side by side with every other industry, and ensure that it is sustainable, not just to the industry, but to also those that practice in the industry, we'll keep having quacks taking care of our most precious item, which is our health. So we need to ensure that we make the sector, so we build it in such a way that individuals, the best minds that truly want to be in Nigeria, have a place to practice.
But they're already here at UPTH.
Yes,
now,
but you see,
we're taking their services to the premium. Now, I get your
we're not taking their services to the premium.
We are expanding their services.
That is the idea. If we can have even 10 more premium in this place, we'll be doing so much good to the people.
At a higher cost. So it's like
Right.
in between the government and the privates.
Yes.
This is like a hybrid of both of them.
Yes, so you get the best care at the best price.
Okay.
Right? Because if you have 100 consultants in UPTH, you have access to them. There is no hospital that gives you that access. Now, the beautiful thing about this is the multidisciplinary care.
True.
So you need a cardiologist, you have the best cardiologist, you have the best nephrologist. And see, we are not the one vouching for this. We are working based on the system the government has built. The government has trained these people. So the best minds are here working with the government. And this facility is also at the behest of the government. They need this facility. So we have our beds, which are inpatient. We have different kinds of rooms. We have our general ward, pediatric ward, private wards, our VIP wards, executive, presidential, yes, sir. So, it doesn't mean that non-presidential can stay there. You can stay there, so let's not call it presidential. We call it presidential, but it's VIP for you.
Okay.
Then we also have high dependency unit. We have an ICU, intensive care unit. We also have a special care baby unit for neonates that need specialist care. Then we have a 3 fully equipped theater and also a labor ward with its own theater too. Then we have a full endoscopy system and imaging, laboratory, pharmacy. So it's basically an all-in-one facility, right? Where a patient can come in and have the same service you have in UPTH. Now note that we do not serve to form as an alternative, right? We are complementary to what exists in UPTH. So it's not a competition really. Rather, what we're trying to do is to support what already exists. We're trying to ensure that we can create more channels for people to come and engage with the value that's available in UPTH.
Okay. All right. So, what would you say? What would be your final word to whoever is listening or watching?
Yes, the final word is at UPTH Premium. Let's focus on creating access to quality health, and that's the objective of everything we're doing here. Access to quality health. So we have looked at it from the perspective of where do you have the best caregivers, and we've identified that as a tertiary institution, that's like UPTH. And so what we have done is to create access to that facility, to that value, to that talent pool through a private sector endeavor, a private sector venture. That's what we have done. So what we are saying is that do not worry about the price because we are cheaper than the hospital probably goes. But of course, even though we are cheaper, the kind of care and service you get is at the same level that you cannot compare with.
Or even more.
No, you can't do more than UPTH. Come on, the professor is the professor, so it doesn't matter. A professor of nephrology is up there, right? So whatever you have there, clinical care, in specific clinical care, the level of clinical care you get there is what you get. But of course, when it comes to the other support services and some level of efficiency, some throughput timing. Probably we do a little bit better as a private facility.
All right, then. Thank you very much, sir.
Thank you.
Really appreciate your time.